welcome to Chatty Lasses, the real down-to-earth talk show packed with opinion, debate and plenty of girly gossip. My name's Bulmer-Cooke and joining me on the panel is the gorgeous Lisa Guthrie.
Hi.
And the beautiful Mel Crawford.
Hello.
Girls, we're in for a treat tonight. I want to talk about a subject that I think divides a lot of people, and that's cosmetic surgery.
Ooh.
So, you know, I like a statistic.
Go for it.
Recent stats revealed that in 2015, the number of cosmetic surgery procedures peaked, with women accounting for 91% of them, and breast augmentation being the most popular procedure.
Right, okay.
Would you, have you, will you?
Are we talking just the boobs, or are we talking
about anything,
anywhere else?
anything.
I couldn't imagine the needles, but I'm quite happy with my small boobs at the moment. They're fine for me because I wouldn't fit into my dresses if I had any bigger ones, so they're fine. The one thing I would say I would get once I've hit, I'd say about 35, or it depends how many low-down episodes I do, Botox.
I've never had it.
Last time in my 20s, I've never had Botox.
I need to sort this out.
I don't know whether to take that as a compliment or not. Like,
You've gotta just
thought
try
my
it.
wrinkle
It's
cream was
amazing.
working. Not so much. Yeah, I would just have, but then I'd be frightened of because you've got to get it so often. But just a little lift there. Just a little lift.
Good forehead.
Just a little lift. But yeah, I definitely couldn't get a boob job or anything like that. Oh, makes us wince.
Lisa?
So when we're talking about things we've had done, we're talking about more under the knife. Are
Anything
we?
you like? Anything that you've done to physically
Where do I
change your
start?
appearance?
Make a list.
Right, hang on.
How long have we got?
Right, let's go. Botox every 3 months, lip filler every 6 months to a year. What else have I had?
The eyebrows
Tattooing, eyebrows tattooing, eyeliner tattooing, lip tattooing. And that's probably...
It's going to have to be an hour-long episode.
That's gentle,
So
I
you've got
think.
tattoos on your lips?
Yeah. But I know I do have a bit of gloss on tonight, but that's to get them. But if I just go au natural, which I do, I know you don't believe me, but I do with no makeup, it's nice because then I have to have like a bit of an outline on my lip. The reason why I got it done is because I felt that my lip just was the same colour as my skin. Like my tone. They weren't like, I didn't have like a pink lip or a red lip.
Just like an all over smudge.
I wanted to be like Snow White. It's just like I didn't have a mouth. I just had these teeth.
Where
Definitely
does it
got
stop? Like, would you have anything else done? Would you consider anything
Yes,
else?
would I have stuff done?
Okay, what would you have done?
Right, so I breastfed both my boys. I would have a bit of a baby lift maybe because they've gone a bit droopy. They're not bad. They're like they're small and like you said, they fit in. I wouldn't go like big or anything where I can't fit into stuff. I would keep them small, but I would just make them a little bit more round, a little bit more up here. What else would I have?
Would you have a butt lift?
No.
Like, would you get a Kim K?
I don't mind. I mean, bum is... See, I've got a fat bum, so it's not that saggy because it's got so much fat in it. It's like quite round anyway. Like if I lose weight, like yeah, like the boobs drop more, the bum drops a little bit more. So if I keep a bit of weight on, it's not too bad.
It's in the right areas.
I might have a little bit of a... Would I have a nose job? I might. Yeah.
What's the matter with your nose?
I don't know.
Listen, if
I've
anybody
always
here
felt like
needs a nose job.
I'd get a nose job. Why? Don't know.
I just think it's a little bit fat, maybe. Like a bit of a fat nose.
Dear me, woman.
But yeah, I would. But you know what it is, right? I just think I'm quite happy at the minute, but I just believe that if you are really not happy with something and it makes you miserable, then who is someone to tell you that you can't go and get that fixed? If you want to get it fixed, you get it fixed.
But I struggle a little bit with, if it's not essential, why would you put yourself through it? Like, my boobs are not good. They were an A, they were a double D when I was pregnant, and they are back to an A.
Wow.
You could only imagine the state of them, right? Car crash. Do I hate them enough to have an operation on them? No.
But that's you.
But would I like someone to wave a magic wand over them and change them? Absolutely yes.
What I don't understand is the trend at the minute of the lip fillers. Because I don't understand girls who are 19 and 20 getting lip fillers because that's all they see on Instagram. I don't get that. Yeah. For me, and then they get it so much, and they're 19, 20-year-old, and you're like, but you just look ridiculous.
Yeah, I don't like the lip fillers like that. But I think it's got to be.
It's quite a serious trend to be getting stuff in your
Should
lip.
I agree.
Age be lifted?
Yes, I do agree with you there. Well, no, I'm saying I agree with you there. It depends on the individual. It depends. You know, if you've got, say, a 18-year-old, 19-year-old, and they are so miserable, like they are so depressed, and they won't come out the house, they hate their body, they hate the way they look, and something like that is going to boost them, then, you know, could you really say no?
No, I think just go and do some exercise, you'll feel better.
No, but if it's like
I think it depends how again, it's sort of relative to each person, relative to each individual. I think if you're sensible enough, and certainly if you're young, and it's certainly more of a thing that's taking you down, it's really affecting you mentally, and then you sit down and you talk with parents and get, you know, specific medical advice.
But should it be the first point of call? Should it be, I hate myself, I'm going to change something about myself? Or should it be, I don't like X, Y, and Z about myself, so I'm going to go and try and work on that a little bit more in here.
Yeah.
And then if I'm still not happy, then I'm going to go and have it done.
Yeah, it's got to be, you know, if you've been, you know, really, really miserable and down, and, you know, you've like you say, tried other avenues and you're still not happy, maybe tried more invasive things, you know, and it hasn't worked, then if it's the only option, then so be it. I say, I mean, you're saying you wouldn't have it done, but that's because you mustn't mind it that much, Katie, because
I don't mind it when I'm standing up, but when I lean forward, they're like two piping bags.
Yeah, I get it, because I've got it too.
And empty piping bags.
Gravity.
Like, I would get it, but I'm not at that stage yet, so I'm not.
Are your piping bags
bothered.
still half full?
Oh, well, you know what? They're like, well, they are half full, yeah. Like, but I'm not at that stage where I'm that bothered that much. I've got other things going on at the minute. It's not like, you know, I must get that done.
I think it's, for me, why I don't sort of get or sort of agree with on this sort of thing, again, like I say, it's always relative to the person, but it is sort of younger girls and guys, definitely both, but it's these who let sort of social media and Instagram lead their life, because it's a false reality. The filters that you use every day, it's, you know, girls that become obviously obsessed. It's like the bodybuilders, when that suddenly become like the trend again, but it's sort of all the poses and everything you see on Instagram. It's like, oh, that's not really what you look like, and your life isn't perfect what it looks like. And people, if they're not really necessarily mature enough, or that's all they see, and it's your life, it's in front of you, it's in your hand every day, it's in your bag, it's in your pocket. If you're not watching telly, you're on it. It's that sort of lifestyle. It's the trend of going, right, I'm going to go and get my boobs done, I'm going to go and get Botox, I'm going to get my lips done.
I do think also, though, more surgeons need to say no. You know, it's a case of, there's nothing the matter with you, I'm not doing it. And I do think there needs to be more of that, and I know many who do say no, you know, whether it be lip filler, whether it be Botox, no, you don't need it, you're not having it. There's a lot of surgeons who are quite happy to just say, yeah, let's do it.
Someone once told me I did need Botox.
Was it me?
Probably. Well, she just said I needed it 5 minutes ago.
Does it look like a sheet of A4 lined paper, this forehead? I think, like, Mel, you made a really good point about social media. I think people have become far too influenced by external forces. Did I care about my piping bag boobs 5 years ago?
Do you know what? I'm never going to be able to ice a cake the same way again. Really.
See if you're stuck, just invite us down. But now I'm much more conscious, and I should be, you know, in theory, on paper, I should be happy with myself. I wear a size 8 to 10 clothes, I'm fit, I'm healthy, I should be happy with myself. But because I look at other people online, I've managed to pick fault with myself. And I can really see how it can be quite easy to go down the line of, I need to change everything. I am all for people being happy with themselves, and if that makes them happy, that is good in my book. But final quick fire questions. would you, yes or no, change something about your body and go through with it?
As in cosmetic surgery?
Yes.
No.
No? Lisa?
Like, maybe down the line, if I was really miserable with something, then yeah, like, I wouldn't rule it out.
At the moment, no, but I think I feel differently about my body now than I did 10 years ago. Who knows how we'll feel in the future, but somebody who can enlighten us is a certain cosmetic surgeon who'll be joining us after the break. Don't miss it, we'll see you soon. Bye! And welcome back to Chatty Lasses. Now, before the break, we had a very divided opinion, didn't we, ladies, on cosmetic surgery. And here to clear all of that up is Dr Dutta, cosmetic surgeon. Welcome to Chatty Lasses.
Thank you.
Dr Dutta, you heard us before the break. You heard our differences of opinion. What are your thoughts?
Being in the industry myself, the only thing that I'm seeing is socially, people are much more receptive. 25 years ago, if you talk to your mum or auntie, they wouldn't have thought anything about cosmetic surgery. In fact, they still would find it ridiculous. As a doctor, I feel responsible because we have to promote it in a sensible way. It is our responsibility to make sure that the public understands that this is not just having Botox or fillers, it's surgery. And the same principles of surgery or medicine applies to cosmetic surgery. So we shouldn't cheapen it the way social media often does. I know you talked about lips, and that is where the society is going. And you'll also see social media has got a huge responsibility, because 90% of the pictures that we see in our magazines are photoshopped. And even they're beautiful ladies and they're photoshopped. So where do we stand as average human beings walking down the street, looking at our mirrors, and we think we are not enough. We feel inadequate in ourselves. So we have to change that culture. But also, you talked about saying no. You mentioned about saying no. I think we need to identify the people who we can do good, and we also need to identify the people who actually are going out of there to have something, and that procedure will do them damage.
Yeah.
And if we can't identify those people, we are selling our services short. And as a doctor, we will feel we haven't done justice to the patient. Patient protection is paramount.
So Dr. Dutta, how long have you been in the industry for?
I have been in cosmetic surgery since 2000, so 17 years.
And what is the procedure that you perform most frequently?
In the Northeast, I've got 2 clinics in Newcastle, as you probably know, in Sunderland. In the Northeast, it's mostly liposuction and then the non-surgical, the usual Botox and the fillers and the lasers. But in London, it's different. In London, it's mostly the facelifts, the breast augmentations, although breast is getting more popular in the Northeast as well.
And have you seen big changes in the procedures that people opt for throughout your career?
The biggest change I've seen, I can still remember, 2000, I went to the local consultants and said, I want a consulting room. And I would often twiddle my thumbs in the evening seeing 2 patients. I would see 1 man in a month or 2. Now, 9 to 10%. You already said you like statistics. 9 to 10% of my patients are men. And there's a change. And the second thing is, people are much more receptive to cosmetic surgery. It is so common now. You will probably be surprised to hear 90% of people consider having it. Not have it, but consider having it.
Yeah.
And then probably 10% of them would go on to have it. But it's much more common than you'd imagine.
You've had a very long career, very successful, but it hasn't been without controversy.
Absolutely.
Can you shed some light on the story behind the headlines?
Well, I can't tell you about the patient, of course, but it was a breast augmentation which was done by one of my colleagues, and it had a complication, a normal, natural complication. It went through 2 further operations. He did it, and I ended up doing the 4th one, which of course ended up with another complication. And it was absolutely unavoidable, but at the same time I could have done things better. And you learn from it and you move on, but at the same time you have to always keep the patient in the center and make sure the patient is protected. On that occasion, the patient had complications, and it was awful for the patient and as well as for me.
Is it a risky business? Is it, you say people are entering into it much more readily now than ever before, and much more, it's on their radar more than it's ever been.
Absolutely.
Should people still be aware of the risks associated with having a cosmetic procedure?
There are 2 or 3 good things are happening which you probably wouldn't know. One of them is that General Medical Council, the Royal College of Surgeons, they're already looking at, and even the Department of Health, are looking at how to make the industry safer. You would know that there are many, many clinics who just, you walk in and you can have what you want. In our clinic, we have statistics. We turn away about a third of our patients. We have a questionnaire which is about 21 pages, and 2 of them are dedicated to life events, history, depression. We contact their general practitioner because there are so many things that could have happened in the life of the patient, and we wouldn't know as a cosmetic surgeon because we're independent. Every factor needs to be taken into account before you put that patient under the knife.
I was going to say, when does ever sort of business override the ethics? Like if you had a young girl come to you with cash in hand and wanted a boob job, but it was quite clear she doesn't really need one, but she was very adamant, no, that's what she wants and she's got the cash. When is it that what takes over, business because that's a paying customer and that's what she wants the product, or ethics because, well, actually, well, how about we look at it and take it from a point of view of you don't need it, what other path and route could you go down rather than cosmetic surgery?
Remember, cosmetic surgery in itself, it is something that you are choosing. You don't need to have it. It's like not a lump on your head where you go to your GP and the GP says, dental work, you're a dentist.
Yeah.
That needs to be done. There is no cosmetic surgeon in the world that needs to be done. Patient wants it. So there is a relative difference between need and want. Then comes the question whether the patient will benefit from it or not. Did Wayne Rooney need a hair transplant? All the big lips you talked about, all the buttock augmentations you talked about, now there's a name for it, as you know, called Brazilian butt lift. We do it. Does it need to be done? You have to assess why the patient is asking. Is it just for our own confidence? Is it something that the patient has thought about it for some time and then decided that I really am in a point in life where I could do a little bit confidence boosting?
Yeah.
That's fine. But I have done some young ladies, I'll give you an example. This is an absolutely true example. As you probably know, there are a couple of lap dancing clubs in Newcastle.
You're probably aware.
And some of the girls are actually in university. They do that to supplement their living. They're from reasonably good families, and we shouldn't judge them. What I'm saying is they're doing it just to support their education. And 1 or 2 of them will come and say, I would like to look better. Can you do a liposuction? And you can see them. I've got 2 daughters. And I can see them. They look absolutely amazing. And the thing they will say is, if I don't have a little bit better looking tummy, I'll get 2 dances less that night. And where is the judgment call here?
Would you allow your own daughters to have cosmetic surgery?
Well, I can't talk about my daughters per se, but if they felt that needed to, yes, of course. Because it is something that I would not encourage them, but if they felt they needed it, I wouldn't stand in their way. That's the way I look at it. But the society is different, think about it. We can now go and have our eyebrows changed, we can have our lips changed. We are having, people are looking at other people in a very critical way. You're going down the London tube, you're looking at people, oh, he could have had a little bit better look. Like you said, you could have.
You should have a bit better.
So it's...
I'm only messing with that. I'm only messing.
It's that we are judging each other all the time. And that didn't happen. You were happy to see your grandmother at a christening, even though she had a few hairs sticking out or didn't look that presentable, but you were happy grandmother came. If grandmother came today with a few hairs, people wouldn't just...
I take the wax bucket when I go and visit my grandmother. I'm not sitting looking at that when we're having a conversation. It's like, sit back, plug it in, right, come on.
But you understand what I'm saying, is that people are judgmental to our own near and dear people. Before, that didn't exist. And in a nicer way, we are much more affluent than what we were 25 years ago. And society has changed, people are much more receptive. And the question is, why not? But we must remember, patients' interests must be protected. We fall short sometimes, but at the same time, we need to correct it. We should be there for the patient. And side effects happen, and we need to just make it right as much as possible.
What's the craziest thing you've been asked to do?
We had a lady who had 3 children, and then she wanted about 5 or 6. I have done extreme makeovers, so I've done 4 or 5 operations on one patient with a full team. I don't think that's sensible. That's my personal. Although I've done it. I've done. I mean, it was on TV, so I've done Jade Goody's mum on TV with a full team. I wasn't the lead surgeon, but I was part of the team. But at the same time, those sort of surgeries shouldn't happen.
So the message is, girls, it's got to be sensible, hasn't it, Dr. Dutta?
Absolutely.
Thank you so much for sharing your knowledge with us, and make sure you join us again soon for another great episode of Chatty Lasses. Bye!